Hello everyone. Today, we're delving into the world of a medication called Percocet, known by its generic name, oxycodone/acetaminophen. As always, this discussion is intended for educational purposes. If you have health-related questions or concerns, please seek guidance from a medical professional. Description: Percocet, or oxycodone/acetaminophen, is a prescription medication that combines two active ingredients, oxycodone, an opioid pain reliever, and acetaminophen, a non-opioid pain reliever and fever reducer. It is classified as a narcotic analgesic and is primarily used to manage moderate to severe pain. This combination medication provides pain relief by acting on the central nervous system and altering the perception of pain. Oxycodone/acetaminophen is available in various strengths, with differing amounts of oxycodone and acetaminophen. Percocet is commonly prescribed after surgeries, injuries, or for chronic pain conditions when other non-opioid pain medications are not sufficient. It should be used under the careful supervision and guidance of a healthcare professional due to its potential for dependence and addiction. Warnings: Percocet comes with essential precautions and warnings. It is a potent medication with the potential for abuse and addiction. It should only be used by individuals for whom it is prescribed, and it should not be shared with others. It is not intended for long-term use unless directed by a healthcare provider. Before taking this medicine. Before starting Percocet, it's crucial to discuss your medical history and any current medications with your healthcare provider. Inform them of any allergies, especially to opioids or acetaminophen, as well as any history of substance abuse. It's essential to mention if you have any liver or kidney problems, as well as any respiratory conditions like asthma or chronic obstructive pulmonary disease, COPD. If you are pregnant, planning to become pregnant, or breastfeeding, consult with your healthcare provider, as the use of opioids during pregnancy can have risks. Do not take Percocet if you are allergic to oxycodone, acetaminophen, or any of its ingredients. Inform your doctor if you have a history of alcohol or substance abuse, mental health issues, or if you are currently taking any medications that may interact with Percocet, including sedatives, tranquilizers, other opioids, or medications for depression, anxiety, or seizures. Side effects: Like all medications, Percocet can have side effects. Common side effects may include drowsiness, dizziness, nausea, vomiting, constipation, and headache. These side effects can often be managed, but it's essential to report them to your healthcare provider. Percocet also carries more severe side effects, including respiratory depression, slowed or shallow breathing, which can be life-threatening if not promptly treated. It may also cause allergic reactions, liver problems, and an increased risk of overdose if taken in higher doses than prescribed or in combination with alcohol or other drugs. Interactions: Percocet may interact with other medications, including other opioids, sedatives, muscle relaxants, and certain antidepressants. It's crucial to inform your doctor of all medications, supplements, and herbal products you are taking to avoid potentially dangerous interactions. Dosage: The correct dosage of Percocet is essential for safe and effective pain management. Always follow your doctor's instructions regarding the dosage and frequency of this medication. Do not exceed the prescribed dose, as it can lead to overdose, serious health risks, or death. The strength and formulation of Percocet may vary, so be sure to read the label and instructions carefully. It's vital to take it as directed, and if you have any questions or concerns about your dosage, consult your healthcare provider. Avoid: While taking Percocet, it's crucial to avoid alcohol, as it can enhance the sedative effects and increase the risk of side effects, including respiratory depression. Also, avoid activities that require mental alertness, such as driving or operating heavy machinery, until you know how this medication affects you. FAQ: Many individuals wonder about the safety of Percocet in older adults. It's important to note that older adults may be more sensitive to the side effects of this medication, particularly the risk of falls, dizziness, and respiratory depression. Dosing adjustments may be necessary, so it's essential to follow your healthcare provider's recommendations closely. Closing: That concludes our overview of Percocet, or oxycodone/acetaminophen. Remember, this information is meant to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns related to this medication. Thank you for tuning in.